Hi everyone, I'm Dr. Sultana, and today we are going to have a webinar on menstrual hygiene. Today is World Menstrual Hygiene Day. Today I want to make you understand about few facts and what is female reproductive system and what is menstrual hygiene so that you may take care about it. For your young ones, it will be helpful for you, and also at the stage of menopause, also you will ultimately know what you need to do and what not to do. So let's start our webinar. So as we see from HOPEWIN Hospital and SNGS, we are going to celebrate World Menstrual Hygiene Day on May 28th, and theme of 2025 is Together for a Period-Friendly World. So if we see, we have to be breaking the silence, breaking the stigma, menstrual hygiene and awareness for all. And also menstrual hygiene matters. Let's talk about it. And periods are not dirty or shameful. They are a natural part of life. And my body, my choice, and my period, let's break the stigma. So this is the campaign we are going to do. We are going to celebrate this with a few people who are deprived of few facilities so that we are giving them these sanitary hygiene pads so that we celebrate in a proper way. We help them to understand and feel confident about their menstruation. So let's start this webinar for making you understand about the parts and functions of the female reproductive system. So what does the female reproductive system do? It's a unique characteristic of female reproductive system is its ability to give temporary and safe place for the developing human being, and the system accommodates the entry of the sperm cells and gives space for the developing baby. It has important parts with specific characteristics and functions. So first thing is fallopian tube. As you see here, one tube is there on the both the sides, right and left. And these tubes are also known as uterine tubes or oviducts, are a part of female reproductive system. Their primary function is to transport eggs from the ovary to the uterus and serve as a site of fertilization. And they are essentially a conduct for the ovulated egg, and in the case of successful fertilization, the embryo. And these are the ovaries on the right side and the left side. Ovary play a critical role in both menstruation and conception. They produce eggs for fertilization and they make the hormones estrogen and progesterone. And an ovary releases an egg around the middle of your menstrual cycle, that is around day 14 of the 28-day cycle, or 14 days before your menstruation. That is, if it is a 40-day cycle, before 14 days, that is 26th day may be the ovulation day. So likewise, before this is a part of a ovulation process. So uterus, which is also called the womb, is shaped like an upside down pear where the unborn baby is developed. It has soft, smooth inner lining called uterine lining or endometrium. So this uterus plays a key role in your reproductive health and function. And the main three jobs of your uterus is pregnancy, where your uterus stretches to grow your baby during pregnancy. It has also contract to help push your baby out of your vagina. And then fertility, your uterus is where a fertilized egg implants during conception and where your baby grows. And menstrual cycle, uterus also play an important role, and its uterine lining is where blood and tissue comes from during menstruation. And cervix, this is the lower part of the uterus, and the cervix is a narrow opening between the uterus and the vagina, which enlarges to let the passage of a fetus during the birth. So the vagina, which is also called the birth canal, is a hollow muscular tube that leads to the opening called vulva. It expands to let the baby pass through during normal delivery. So how does the female reproductive system work? It is producing the eggs and also menstruation, have sexual intercourse, and also protect and nourish fertilized egg until it is fully developed and give birth to a new one. So the menstrual cycle. So what is it? Menstrual cycle is a cycle which begins at puberty to prepare the body for pregnancy. It lasts around 28 days, but can be a shorter or longer, especially if a young person has just started having periods. So how will be the day one? Day one will be having bleeding from vagina begins. This is known as having a period or menstruation, and it is caused by the loss of lining of the uterus, as we see endometrium. A period usually starts on average about 4 days. However, it can be longer or shorter depending upon the situation of the or medical condition. So day 5, the bleeding stops and an ovum starts to mature in one of the ovaries. The lining of the uterus starts to regrow. So on the day 14, the mature ovum travels through the oviduct towards the uterus. This process is called ovulation. And on day 28, if the ovum has not joined with the sperm cell in the oviduct, the lining of the uterus begins to break down again. The cell starts again. So here comes the menstruation. So then the period comes. There are lots of different ways to help you feel comfortable on your period and make the blood loss more manageably. And these include pads, tampons, menstrual cups, and more. So you may want to try a few ways before you find your preferences. So few hormones changes are there during the menstrual cycle, and it is controlled by hormones such as estrogen and progesterone. Estrogen, if it is growing, then the lining is growing inside, and also you will be having pimples or some oily skin or other symptoms in you. And progesterone, it will help the lining to share. So these are the chemical messengers which are produced in glands and control the cycle. Changes in hormone levels can also contribute to some menstrual symptoms such as mood changes and spots. So few tips we can say as remember that we all are different. So periods and menstrual cycles can really vary from person to person. If you are struggling with your periods or feel something is wrong, there is always a help and you can ask for some medical advice with your gynecologist. So what we need to do is first we need to start the conversation about it. If we see like before getting period, that is menarche. Before menarche, the stage in which they get periods is between 10 to 12 years or 12 to 14 years. So in this stage, we can start conversation with them. So in early stages, begin discussing menstruation with your daughter around age 8 to 10 years, of course, and using age appropriate language, not like biggest language, but just make her understand what it means, what it feels about. So be open and honest, create a safe and supportive environment where your daughter feels comfortable asking questions as well, and use accurate information, provide factual information about menstruation, its purpose, and what it does, and what to be expected. So what we need to do for preparing menarche. So explain the physical changes, what will happen, discuss the physical changes that occur during puberty, including breast development and pubic hair growth as well, and also axillary hair as well. And also introduce menstrual products, show your daughter different types of menstrual products such as pads and tampons, and explain how to use them and how we can make our menstrual cycle very easy. So practice good hygiene. Teach your daughter good hygiene practices such as washing hands before and after handling menstrual products. So what will be the essential items we need to make them understand, or we need to make them have in their have in their bag for the preparation in those days. So sanitary pads or tampons, So include a variety of menstrual products to cater to individual preferences. Menstrual cup, a reusable and eco-friendly option for those interested. And period panties should be kept comfortable and absorbent underwear for added protection. So wet wipes can be kept convenient for personal hygiene on the go. And pain reliever medication they can carry. Over-the-counter pain relievers for menstrual cramp management should be there. So, what will happen if we are maintaining a pure, means a very not proper menstrual health? Or nowadays, menstrual hygiene term is replaced by menstrual health. So, we need to take care of it. If we have poor menstrual health, then it may lead to few complications, such as it may lead to few infections, that is bacterial infections, fungal infections, and also viral infections. So it may lead to UTIs, that is urinary tract infections, and reproductive tract infections can occur due to using unclean or damp menstrual products. So repeated infections can lead to complications in the reproductive system, potentially affecting the fertility. So skin irritation, prolonged use of soiled pads or tampons can cause skin rashes, irritation, and discomfort in the genital area. So toxic shock syndrome, it may be due to the tampons, that is leaving tampons in for too long, increases the risk of toxic shock syndrome, a rare but life-threatening condition caused by bacterial toxins. Then yeast infections like poor menstrual hygiene can create an environment conducive to yeast overgrowth leading to infections. Then cervical cancer risk. Chronic infections due to poor menstrual hygiene may increase the risk of cervical cancer over time. And cervical cancer that is caused by HPV, that is human papillomavirus. Then fertility issues may arise. Repeated infections and poor hygiene can lead to reproductive system complications, potentially affecting fertility. So few myths I want to discuss here about it. Like myth one, menstruation is dirty or impure. So the reality is menstruation is a natural biological process where the uterine lining is shedding and recreating. So myth two is women should not bath during menstruation. No, it is not a reality. Reality is bathing or showering is essential for the hygiene and comfort during menstruation. So myth three, menstrual blood is bad or toxic? No, it's the reality is menstrual blood is normal bodily fluid. Then another myth we are saying is women are weak or incapacitated during menstruation. No, it is not so real. That is, most women can continue daily activities and some adjustments with some adjustments. So myth five is menstruation should be kept secret. No, the reality is it have to be having open conversations can help break stigmas and promote understanding about menstruation as well menstrual hygiene. Then another myth I'm hearing is certain foods should be avoided during menstruation, like buttermilk, like goa, or some foods which may be leading to some smell in your body. But that's not the reality. No specific foods needed to be avoided, but a balanced diet is recommended during menstruation. So myth seven, it is menstruation is a sign of illness or weakness. No, the reality is menstruation is a natural part of reproductive health of a woman. Another myth is women can't participate in certain activities during menstruation. But the reality, with proper hygiene and precautions, women can participate in most of the activities. So, some more are menstrual cramp pain is just part of being a woman. No, it is. Cramp should be a common. Cramps, menstrual cramps are common sometimes, but if it is a severe pain, it can be a sign of underlying issue. That is, it may be endometriosis, it may be fibroid, but we need to have a check on it. So myth 10, it is you can't get pregnant during your period. So the reality, while the chances are lower, it's still possible to get pregnant during your period. So menstruation is the same for every woman. So reality is menstrual cycles and experiences can vary greatly from woman to woman, of course. And another myth I'm hearing is using tampons will make your lose your virginity. So this is not real, and virginity is a social construct, and tampon use has no relation to it, and you can easily use tampon if you're comfortable in it. So myth 13 is menstrual blood attracts insects or animals, but the reality is there's no scientific evidence to support this claim. And then another myth we are hearing is you should avoid exercise during menstruation. No, as such. Reality is exercise can actually help alleviate menstrual cramps and improve mood. Unless until they are very vigorous, just practice soothing exercises, soothing yoga. You can practice meditation, you can practice. And another last myth is menstruation is a taboo topic that should not be discussed. But dear, reality is open conversations about menstruations can help break down stigmas and more understanding about menstruation process and also menstrual hygiene, which is very essential for women health. So most of the queries, I hear most of the queries as a gynecologist, many of the girls parents come to us and ask many of the questions. I have arranged them as questions here so that it will be helpful to you to understand. So, first thing is what is menstrual hygiene? So, practices to maintain cleanliness and health during menstruation is menstrual hygiene. And why is menstrual hygiene important? Prevents the infections as we discussed, promote comfort and also supports overall health. So, product related queries I have heard is what are the best menstrual products they want to means let us see depending upon the lifestyle or depending upon their affordability or depending upon their comfort. So individual preferences will be there and lifestyle and needs will be there so that pads are comfortable. They will use pads or tampons or cups can be used, menstrual cups. So how often should I change menstrual products? So regularly, you need to change in between 4 to 8 hours. If it is very heavy, they can change within 2 to 4 hours. It should be changed so that it will not lead them to adversities. So 6 hours mostly, 6 to 6 hours. In within 6 hours, they need to change. So whenever it is needed, also it should be changed. So health related queries I have heard is can poor menstrual hygiene cause infections? That the answer is yes, yes, and yes. So bacterial vaginosis, yeast infections, and other conditions also are due to poor menstrual hygiene, and it causes a severe infections. How can I prevent menstrual cramps? So over the counter pain relievers you can use, heat therapy, heat massage you can do, and also lifestyle changes you can do, and diet modifications. A few sort of pineapple juice or papaya and dates can ease, and also some sort of what we say is a white till uh, they can use. So these sort of sesame seeds are there, now they can use those to relieve such pain during the course of month. They can use such a good sort of vitamin E and fiber diet they can take so that the menstrual cramps can be eased. If they are severe, they need to go for a medical advice. So social and cultural queries, why is the stigma around menstruation? So why we see is it is coming from the ages, that is cultural and social norms are there, lack of education and lot of misconceptions, as we have seen the myths, a lot of myths about the menstruation. These all things which are making us not to discuss more about it. So how can we promote menstrual hygiene awareness? So surely, as we see today, we need to have education about it, open conversations about it, and supportive policies should be there in the government. As I have seen, as I have researched, a lot of policies have been there, and of course, government is supplying for each pad for 1 rupee, and also free supply to the government schools wherever it is possible. So other queries like, can I exercise during menstruation? Yes, with proper hygiene and precautions, you can surely do exercise. And how can I manage menstrual hygiene while traveling? So dear, when you are traveling, just see to that you are carrying some pack extra products, and stay hydrated and plan ahead during traveling. So, few other during hygiene practices, what can you see is how to dispose of sanitary product properly. So, you need to wrap used products in paper or bags and dispose in the trash cans. You should not throw in the commods, like in bathrooms or any open canals. You can't throw. Just you throw in a properly trash cans by wrapping it into one bag or a paper and properly dispose it. So can I use soap to clean my genital area during menstruation? Yes, you can use soap, but it should be very mild. Mild soap is okay, but avoid harsh or scented soaps. So product usage, like how to use tampons safely. So everything will be there in a usage pamphlet. So how to use tampons, you can see many of the videos in the YouTube, that you need to fold like a C and just put into the vagina, and it will be opening in the vaginal canal. So properly cleaning it and again reusing it. So follow the instructions, change regularly, and avoid leaving it for too long time. Can I use the menstrual cups overnight? Yes, but follow manufacturer's guidelines and empty regularly whenever it is possible. So, about health concerns, can menstruation affect my mood? Yes, of course, sometimes hormonal changes can impact mood, but individual experiences vary from person to person. So, how can I prevent yeast infections during menstruation? See, that's what I'm saying. This webinar is circulating about this only, that is proper maintenance of hygiene, menstrual hygiene. So, proper practice of good hygiene, wear breathable clothing, and consider probiotics. Probiotics, simple probiotics in today life is curd. You can just take a proper bowl of curd daily for probiotics. And lifestyle adjustments, what you can do is, can I swim during menstruations? Why not? You can swim by using tampons and also menstrual cups, or a period proof swimwear also available, so that you can use and you can do swimming. So how can I manage menstrual hygiene during travel? So as we have seen, that you need to plan, and properly you need to pack extra packs of panties and products. So education and awareness about this. Why is menstrual education important? That's important because we need to promote health and also break a lot of stigmas and myths and empower individuals. So how can we normalize conversations about menstruations? That open discussions we need to do, education we need to have, and inclusive language we need to use. So another word I want to say about is cervical vaccination, that is HPV vaccination. Boys and girls, they can take. The best time is 9 to 14 years. In this age group, two doses are required, that is at 0 and 6 months, second dose. Then above 14 years, it is three doses, and that is at 0 and 2 months, and of course 6 months. So if it is taken, they are protected from cervical cancer and many other strains, which are types, which are they are protected from the other cancers like oral cancers, vulvar and anal, and also in the men, other penile cancers, they are protected from that. So my take home message is, menstrual hygiene refers to the practice, and also it's that help individuals manage their menstruation with dignity, comfort, and health. And this includes few key aspects, as using sanitary products such as pads, tampons, and menstrual cups or period panties, and changing products regularly to prevent leakage, odor, and infections. Practicing good genital hygiene, that is washing hands before and after handling products and cleaning the genital area, and wearing comfortable clothing, that is choosing breathable, comfortable clothing to help manage menstrual flow. And what is the importance? That is, we need to prevent infections. Good hygiene practices can help in preventing infections like bacterial and fungal and also viral infections, and also promote comfort, that is managing menstruation effectively can reduce discomfort, anxiety, and also stress. Supports dignity, that is menstrual hygiene is essential for maintaining dignity and self-esteem, and also empower women to another level. So dear ladies, I just want you to prepare yourself a lot to be a self-empowered woman by just following these all tips and just breaking the taboo and helping yourself and your women around you to be empowered and follow the menstrual hygiene and go to their heights of success. So I, with this, I end my webinar, and I end my this webinar with a speech. And so that this webinar is very important because today menstrual hygiene is very important, as a woman is very busy in day-to-day life, making herself capable of challenging men in every way, in every situation. But I really wish all the women all the best in their life, reach heights, reach their goals, to very much affordable and maintain menstrual hygiene properly. Happy World Menstrual Hygiene Day. Thank you for giving me this opportunity. And if you have any queries, please free to uh, ping me at hopewinhospitals@gmail.com, and WhatsApp also 8886 466 233. Okay, I'm signing off. Thank you.